Hi, everyone. For this week's discussion post, we're talking about cirrhosis. Cirrhosis is a degree of liver damage where about 80 to 90% of the liver has been destroyed. It occurs due to multiple pathologies such as autoimmune diseases and metabolic syndromes, but is most frequently caused by alcohol abuse. Cirrhosis causes the liver lobes to fibrose, and the previously soft pink liver becomes nodular, which greatly obstructs function. The damage starts with an accumulation of fat cells that cause fatty liver disease. If the direct cause of the fatty liver disease is not treated, it progresses to hepatitis, and if that's not treated, it progresses to cirrhosis, which is irreversible. The major damages the body experiences from liver disease are due to malfunction of the liver cells and obstruction of the biliary flow. Like I previously mentioned, alcohol abuse is the #1 risk factor for cirrhosis. Also chronic viral hepatitis B and C, especially if untreated. Autoimmune diseases such as autoimmune hepatitis, hemochromatosis, primary and secondary biliary cirrhosis, primary sclerosing cholangitis, genetic disorders such as Wilson's disease, medication abuse such as Tylenol and methotrexate, either intentional or unintentional, and a poor diet, so high in fat, which causes fatty liver disease. And then there's lastly NASH cirrhosis, which is very common. It's non-alcohol steatic hepatosis. The cause of that is idiopathic. So major signs and symptoms are fatigue, anorexia, ascites, signs of bleeding, either rectal or esophageal, anemia, thrombocytopenia, jaundice, pruritus, purpura, confusion, hypotension, spider angioma, or dark and colored color urine. So you can see this man's eye is very jaundiced here, the yellowing of the sclera. If the liver disease is significant, you can also see jaundiced skin. These red areas here are the spider angiomas. They're commonly found on the chest and sometimes on the face. This man's abdomen here is very distended. This is ascites, which is just pleural fluid that has gone into the third space that's been pushed out of the cell. Oftentimes you see cachectic looking males with very skinny arms and legs, and then a large distended abdomen. Some diagnostic testing, you can see signs and symptoms of these large esophageal varices. You can see going down here, they're swollen vessels here that can rupture because if there's too much pressure in the portal system. And to treat that, they put these bands around them to try to prevent them from rupturing. And then lastly, you can see over here a very cirrhotic liver. There's no real pink tissue left anywhere. It's just all of these little nodules that don't really have any cellular function. Some basic lab tests are CBC, chemistry, AST, ALT, direct and indirect bilirubin, and an INR. In the CBC, a lot of times people are anemic because either they have a slow bleed from one of these varices, or there's some gastric ulcers that cause bleeding. Their chemistry is usually pretty normal unless the liver disease is significant and it starts to affect the kidneys. You also see hyponatremia because, as you can see here, all the fluid is shifted out of the cells. Their AST and ALT are often elevated, as well as the direct and indirect bilirubin. And because the liver is responsible for a lot of clotting factor, the INR is also elevated. You do abdominal injury imaging for diagnosis. Usually they do ultrasonography because it's the best and the safest. It's one of the easiest ways to find hepatomegaly, ascites, and maybe splenomegaly, and it doesn't expose the patient to any radiation. And then to determine the grade of liver disease, the patient will require a liver biopsy. Also, something to mention is liver disease or cirrhosis can be caused by hepatocellular carcinoma, which is a cancer of the liver, and that would also be found in a liver biopsy. Here are the references. I hope that was helpful. Let me know if you have any questions. Thanks.